Hello, so today we'll start with expectorants. Expectorants are drugs which will help in removal of mucus from your respiratory tract. Classification is in which expectorants are classified under four broad categories, that is either stimulant, mucolytic, diluent, or miscellaneous. Under secretory or stimulant, you have your reflex, direct, and mixed. So, as far as the names are concerned, reflex will act or induce the respiratory tract reflexes in order to cause your reduction in secretion. Direct will technically act directly on the respiratory tract mucosa, causing irritation and thereby causing its mucolytic activity as such. Mixed are, as you can guess, as mixed in action. Secondly, we have your mucolytic, which will directly or indirectly help in mucolysis, that is breaking the bonds of the glycoprotein. Next is your diluent. Diluent expectorants are those which will help in diluting the mucus, or that is reduce the viscosity of it. And miscellaneous may contribute via different methods or modes of actions. So for a basic mechanism of action, here we go. For your uh, secretory or stimulant, we have basically it starts from your gastropulmonary reflex, that is your acidity and your lung reflex, because of which it will cause an irritation to your respiratory tract mucosa, and via the vagal pathway, it will trigger the secretion reflex. That is, it will cause an increased secretion or decreased secretion of your tracheobronchial glands according to the effect. Now, if it is an increased secretion, it will cause an increased secretion of lower viscosity, or if it is a decreased secretion, it will also be of your lower viscosity again. Now, this secretion reflex will cause your bronchial secretion increment and mucociliary activity for clearing of mucus from the respiratory tract, of which the only difference in mechanism of action comes under your mucolytic expectorants, wherein they will help in breakdown of your mucopolysaccharide or glycosaminoglycans by depolymerization. That is a fancy word for saying that it will break the chains, in which there are a few examples which are bromhexine and embroxine, wherein it will cause your mucolysis or breakdown of the bonds via increasing in lysosomal enzymes, increase surfactants which are released by type 2 pneumocytes, that is, it will increase the enzymes or will cause an increased breakage of your mucopolysaccharides. Next is your acetylcysteine, which has a specific MOA, which is basically it has a sulfhydryl group which helps in breakage of disulfide bonds which is present in the mucopolysaccharide. Also, it is a glutathione precursor, which is a free radical scavenger, which will help in prevention of free radical injuries. Now, this may not seem very useful for a respiratory tract treatment. However, this is very useful for your liver enzymes and secretions. So, more of that in the next video. Indications where you can use these expectorants are when there is a cough or mucus buildup that can be seen in almost any general respiratory type infection or conditions that can be tracheitis, laryngitis, rhinitis, bronchitis, pneumonia, a few types of pneumonia at least. Then can be seen in your chronic conditions where you might need palliative care. It can also be used as an emergency drug if required and to clear out mucus plugs of viscid mucus. However, a few things to avoid are: please avoid this during severe pain, that is angina pectoris, due to unknown or occult causes. During pleuritis, as the frictional rub already is painful, to induce pain via an irritant or expectorant is much worse. Obstruction, as that will cause an irritation to the respiratory tract mucosa and will fasten the rate of obstruction and release of mucus. And aspiration pneumonia due to obvious causes. Now, a few dose rates are as you can see, and these are the most commonly used expectorants, that is guaiacol or guaifenesin, your bromhexine, and an acetylcysteine. You may have a look at the dosage, and yeah, that's it. Thank you. Bye bye.